Incredible, almost 12 months of time with the DaVinci robot. Obviously several patients are in the room saying we're excited that you are here to share some experiences, talk with your doctor, play with the robot a little bit and see some of the technology that they use to take care of your procedure as well. Before we get started, I wanted to introduce a few people. Before I get to the surgeons, I want to introduce the surgery team behind the DaVinci success that we've seen at the hospital. And if you would just raise your hand for me when I call your name. Agnes Crownover, Jen Simons, David Wooden, Diane Meyer, and Denise Weibel. This team spent countless hours training prior to the arrival of the DaVinci. After the DaVinci, they work well and mesh with the surgeons to make sure that the processes or the procedures go extremely well. So guys, thank you all for helping bring about the success that we've seen with the DaVinci robot. We've got a couple surgeons here today that are going to speak, but before we do that, I want to introduce all the surgeons in the room. First off, Dr. Mark DeVacia. He was the first surgeon to do, the first DaVinci prostatectomy at our institution last June 24th, wasn't it? It was June 24th, first procedure. Dr. Adam Perlmutter, urologic oncologist. And Dr. Cheryl Short, gynecologist. Again, this is the time to meet and greet, talk with your surgeons, talk amongst each other, share some of your stories, enjoy some of the time you've had since your procedure, take a test drive on the robot itself, and just have a good day of fellowship. So again, thank you all for coming today. We really do appreciate it.
I went through this surgery the 22nd of last month, and currently everything come out fine, doing good. Doctor's happy, and he said he got 100% of it, which makes me feel happy. I'm glad that I had it done, and I think I'll be fine now. And he said 6 months or so, you won't even remember, or you'll think that it's all good as new. Compared to a book I read, and then a couple of weeks after I had the surgery, I would say that this is less painful. You heal quicker, and I know the scars is very little compared to a guy that I met that had it done about 8 years ago. It looked like he had open heart surgery. So this procedure is a lot for his healing and scars go. They were very good people, very good nurses, checked on me all the time. Hopefully 6 months, like you said, that I'll be able to do everything I ever did before and not even know it.
But our first case, June 24th, and subsequent cases were all just fantastic. They went great. And the reason for that is because it was a marriage of skill, experience, and technology. And the technology is right here. It's great technology. You can't really say enough about it. The robot certainly has made it a much more efficient, a much better procedure. And certainly I think there are probably plenty of people in this room who can vouch for that. So really thank you to the community family and to all the staff we have, and it just makes it a pleasure every single day.
As opposed to 6 to 8 weeks standing.
When we implemented the system here, I think it was June of 2008, like Dr. DeVacia just said, you know, he came here with a ton of experience coming from the community system where he implemented the program, and right immediately it was a successful start. June 24th was the first case. You know, the technology, there's a capital investment, and I think the surgeon said it best, is that it's an entire team from the administration, the surgeons, and the OR staff, and without that support and that commitment, you can't have a successful robotics program. So it's an entire team, and Porter certainly done their best to make it successful.